Men's sexual health has been an area of health that has seen stigma, misinformation, and a reluctance to open up and discuss current challenges being faced. Many men suffer from sexual health issues but are either too embarrassed or afraid to bring it up, or lack the proper education to even identify the affliction in the first place. This lack of proper education has the ability to lead to unnecessary cases of disease and cause mass panic among those who are impacted by them. Knowledge of treatments and preventions are also important, as this information will not only help prevent additional cases, but bring a sense of peace and assurance among individuals as they can know that they are doing what they can to prevent disease development. Preparation is key when attempting to avoid the larger negative implications that sexual health brings with them. Some of the topics being discussed today are common sexual health issues, stigma around sexual conversations, prevention and treatments, and the importance of open communications. Additional helpful resources can be found at the CDC, NIH, and the Men's Health Network website. There are many different sexual health issues that can impact men, so it's important to be aware of them so you can properly research them and be prepared. One of the more common health issues that impacts a large majority of men is erectile dysfunction, also known as ED. This is when the individual has difficulty obtaining or maintaining an erection. At age 40, about 40% of men report suffering from erectile dysfunction. By 70, this percentage rises to 70% of all men. With this condition being so common, it is important that men have a baseline knowledge of what ED is, understand that there is a high likelihood that they may be impacted by it, and that they are not alone. Another major sexual health issue is STD. STDs come in many forms, notably chlamydia, gonorrhea, syphilis, hepatitis, and HIV. Such conditions can result in serious consequences if left untreated or ignored. However, many of them can be prevented with proper, safe sex practice. Understanding their transmission is key to prevention. For more information on sexually transmitted disease, look at Men's Health Network website for useful resources. Sexual health has suffered immense stigma over generations. There have been many long-standing societal stigmas and pressures to act, discuss, and treat sexual conversations and health in very specific ways. For example, HIV and AIDS have suffered great stigma and misinformation from being labeled as a homosexual disease. However, the truth is that anyone can contract or spread the disease, regardless of their sexual preference. This misinformation and reluctance to discuss the topic appropriately has led to many unnecessary cases of the disease across all populations. There can also be stigma against discussing sexual health due to religious or community beliefs. There may be pressure to not bring up such topics since the individual may not have reached an appropriate age or stage of life where such things should be a concern. This can be incredibly harmful as it restricts vital information from being given to the population and increases risk for disease development, transfer, and among other concerns. Open discussion can be crucial when deciding next steps and potential treatments, as we will discuss later. Luckily, there are many effective treatments for some common health afflictions. When looking at HIV and AIDS, medicines such as PrEP and PEP can be life-changing. These medications help those living with HIV or at risk of contracting it from suffering from their negative impacts. In fact, these medications are so powerful that when an individual with HIV begins taking them, their levels of HIV become almost undetectable. However, if medication adherence is not followed correctly or stopped altogether, then these benefits will quickly disappear and all negative consequences will return. Erectile dysfunction also has many effective treatments. Some of these treatments include Viagra, Cialis, Levitra, and testosterone boosters. Some of these medications can be bought over the counter, making them very accessible for the general public. Having such easy access to these medications allows for swift action to be taken once diagnosis occurs. However, like the medications for HIV and AIDS, their effects only last as long as they're taken. ED drugs will need to be taken every time that the man attempts to achieve an erection. Open communication is key when dealing with sexual health, especially when talking to a healthcare provider. Healthcare providers ask for your sexual history levels during a checkup not for their own interest, but because they may ask if you are properly educated on certain risks and aware of all protective measures. This communication is even more important if the individual is currently suffering from a sexual health issue. Individuals may feel scared or embarrassed to bring up such topics to their doctor, especially if they are the opposite sex. But such discussions can be life-saving. Some of the treatments that have been discussed in this talk are only available with proper doctor's orders and a registered prescription. Additionally, communication about sexual health concerns must be discussed with partners. These health afflictions can easily be transmitted from one individual to the next, so it's important to make sure that both individuals are aware of one another's health status and have the freedom to decide whether or not to engage in sexual activities with the other. In some states, it is illegal to knowingly withhold information about your HIV status with partners and can lead to criminal charges being brought up.